Welcome to AFSPA Talks, a production of the American Foreign Service Protective Association. Each month, we deliver informative health and wellness topics you want to know about, so make sure to subscribe to us on your preferred podcast platform. And if you have any questions about content discussed in this episode, ask them at AFSPA Live, our live Q&A session streaming every last Thursday of the month at 11 a.m. Eastern Time on youtube.com/AFSPA Cares. Now here's your host, Chief Executive Officer Kyle Longton.
Hi, and welcome to another episode of AFSPA Talks. I'm Kyle Longton, and my co-host with me is...
Maddie Norton.
Maddie, it's August.
I know, back to school time.
We've got to get these kids out of my house.
They have to leave. They have got to go back to school.
And I say that having been on business travel for a lot of July, and being in the office recently and so forth, but we've got to get these kids out of my house.
Right.
I have two fourth graders and a first grader, and school. This is coming out on what, the
18th.
The 18th.
Yep.
There's another 8 days until they start school. Once this comes out, they don't go back to the 26th. So we've got to get them out of the house. And we've got to get them started on a good schedule.
Right.
We've been trying to keep them on schedule this summer. It just has not worked. We also had, they spent time in the land of yes, which, they went to visit their grandparents.
I was going to say, yeah.
Yep.
The land of yes.
And it was just my wife with them, and there's only so much you can do against that much resistance. I'm just glad she survived. But
exactly.
I'm just, every year we go through this, and every year I think I'm going to be ready.
Right.
That's June Kyle.
Right.
June Kyle thinks this is going to be easy, but August Kyle is just hanging on by my fingernails. And so I'm looking forward to AFSPA Live. I'm wondering if you can tell us a little bit about AFSPA Live.
AFSPA Live may have been made for you this month, Kyle. On August 28th, Thursday at 11 a.m. Eastern Time. I almost said 11:30. 11 a.m. Eastern Time, we will have Maven back to talk about how to prepare for back to school, about any routine questions, if any of your children have anxiety about going to school, back to school. I know I did as a kid. I was just like getting back into the routine is just a lot to handle. So we will have Maven on, a little expert, to discuss all those things, and we hope you tune in. I know you'll be there, Kyle, but
I will, and I promise I will do my best not to turn it into a personal counseling session. So I'll encourage listeners or viewers, depending on how you're receiving this podcast. If you've got questions, send them in to us. Look for information. We'll be sending out emails soliciting questions from you all, and let us know what your questions are, or tune in live and ask in the chat. We love that. Yeah. We love that, and it'll keep me from crying on screen.
Right, exactly. And if you can't make it at 11 a.m., don't you worry. It'll be on our YouTube right after. So if you want to watch it later, definitely do that. So,
that's good.
And then we also have a couple of other things happening in August that I'd like to hit. We have, this will come out on Monday, the 18th. And then on the 19th, we have a webinar, I believe, about transitioning successfully into retirement. Yes, I am right. And we have 3 different time slots for that. And then on Tuesday, the following Tuesday on the 26th, we have a financial wellness checkup with our Prudential partners. So definitely check that out, especially with going back to school. If you just made some student loan payments maybe, or just paid tuition, that would be a great time to check in with them. And so definitely go to aspa.org/events to sign up for those. And August is has another topic for the month, which is it's Breastfeeding Awareness Month, Kyle.
It is, and this is very real. We are actually recording this on Thursday, the 14th, and as I to get to this recording, I actually left a triple baby shower here in our office. We have 3 colleagues who are expecting in the months ahead, some in just the days ahead. So this is I did ask them. I don't know if how HR felt about me asking this.
HR was there.
Yep. But I did ask them if they had any questions before we went into today's topic, which is focused on Breastfeeding Awareness Month. They did not have any questions, but they did promise that they would be tuning in. So I will just say I am not someone who I was not the parent in my relationship who breastfed our kids. My wife, with our twin daughters when they were born, she actually breastfed both of them for right at a year.
Wow, that's
So,
impressive.
and I say that I don't know if anybody else out there has twins. It is not an easy thing to do. Breastfeeding one baby is not an easy thing to
Right.
do. And we're going to talk more about that with our guests today. But the twins was challenging. We did a lot of my wife did a lot of research, purchased the breast pump she wanted. It had a light for those nighttime feedings. Didn't have to turn on the overhead or
And
and
blind yourself in
that's right.
the night.
Expressed milk. We stored it. We bought a freezer actually for that
Wow.
purpose, and then worked with bottles, and that worked. But with our second pregnancy, our third child, when he was born, she decided not to breastfeed. It was not something she wanted to do again, and um, all three kids are healthy. They are all equally driving me crazy right now.
Right,
So we've got to
right.
get them back to school, but others who may be earlier in the parent journey, it is a joy. Let me just say that. But breastfeeding, it is a topic, and there can be pressure out there. Everybody has an opinion, and we are not here to give you an opinion. We are here to try to give you some facts from an expert, and also for Foreign Service Benefit Plan members, give you access to those experts and the support that you need, so you can make the decision that's right for you. And as you go on that journey, if you decide to breastfeed, um, have that continuing support. So, Maddie, can you tell us a little bit about our guests today before we get to the interview?
Absolutely, I would love to. So we have two guests today. We have Mary Rood Cunningham, who is a senior client success manager at Maven. And then we have our expert on breastfeeding is Dr. Viraj Radia. She is a board certified general pediatrician with 10 years of clinical and 2 years of teaching experience, bringing together evidence-based medical care with a focus on educating both patients and parents. She addresses a wide variety of patient needs, including newborn care, injury treatment and prevention, nutrition, growth and development, urgent/emergency care, and management of illnesses. And we are so excited to have both of them on the podcast today.
Let's get to it. Dr. Viraj Radia, welcome to AFSPA Talks. Thanks for joining us today.
Thank you for having me.
And before we get to the topic of the day and really address some questions we received from colleagues as well as from members through the years, I want to talk a little bit about Maven Clinic, and both the support that's available for breastfeeding parents, but also the broader range of programs. And I want to turn to Client Success Manager from Maven Clinic, Mary Rood Cunningham. Can you just tell us a little bit about Maven Clinic, a brief overview of what's available to members of Foreign Service Benefit Plan?
Yes, of course. Thanks so much, Kyle, for the introduction and having us on. Happy to give a brief high-level overview of Maven Clinic. We are the world's largest virtual clinic for women and families, delivering 24/7 at virtual education and support for our members throughout their family building journeys and beyond. So we have our virtual provider network and medically approved resources as part of the Maven Clinic app. FSBP members have access to Maven's full suite of programs at no cost to them. So that includes support across their fertility and family building, maternity and newborn care, which is what we'll talk about today, parenting and pediatrics, and menopause and midlife health journeys. As you can probably imagine, with the topic of breastfeeding, again, we'll be covering Maven's maternity and newborn care program. This delivers 24/7 virtual support throughout pregnancy, postpartum, and newborn care journeys. It also includes specific support for the return to work transition. As we know, that is often a complicated time in life. And we also have a dedicated program for those who may sadly experience a miscarriage and or loss throughout the journey.
Appreciate the overview of all the programs that are available. One of the key questions for our members is, where are the programs available? And is there any difference between the US in particular and overseas?
That is a great question. In short, no difference, no matter where you're logging on as a Maven member. Maven is available in over 175 different countries, so your experience is the same. We have providers all over the world in every time zone, and our provider network speaks over 35 different languages. So you really are able to capitalize on our true 24/7 nature.
Love that.
That's
Excellent.
wonderful and incredible that Maven covers just such a broad, like all ages, and I think that's something that makes Maven unique. And I can't wait to dive into the topic of breastfeeding today. And thankfully, we have an expert with us. So we'll start with the basics. What are the benefits of breastfeeding and how does it compare to formula?
Yeah, so most health organizations would consider breastfeeding to be the best choice for babies. But that being said, they do recognize that breastfeeding is not always the choice. It's not always the right choice for every mom. I would say that myself and most of my pediatrician colleagues really kind of follow a mantra of fed is best. And so that's what I would say is the kind of the most important thing to remember. That being said, the current American Academy of Pediatric guidelines do recommend breastfeeding or to try to breastfeed for 6 months exclusively, and then followed by introduction of solids to try to continue to breastfeed up until the child is 2 years old. But that's also as mutually desired by the mom and by the child. So if at any point one or the other is done, it's very appropriate to stop breastfeeding at that point. So that's kind of the recommendations. Now, as far as the benefits of breastfeeding, there's a lot of things there. We have defense against infections, prevention of allergies. There's protection against SIDS risk with breastfeeding. We also see that it can protect against the development of certain chronic diseases like asthma and diabetes. There's additional benefits to consider, ease of digestion. Breastfed babies don't usually have as much issues with constipation, for example. Reduced costs are there too to consider compared to buying formula. Convenience, especially if you're directly breastfeeding, can be much more of a convenient choice. And then the other interesting one is exposure to flavors. We know that moms and what they eat in their diet can actually change the flavor and taste of breast milk for the baby. And we see that that can correlate to easier introduction of solids when the babies get older. But it's also important to note that there are maternal benefits to breastfeeding as well. So we know that moms that breastfeed, they burn more calories, their uterus shrinks down faster. So we can see a return to the pre-pregnancy state more quickly. We can also see that there's reduction in risks for things like breast cancer, cardiovascular disease, diabetes. It also may help decrease the risk for uterine and ovarian cancers. So that's a lot of benefits, but I will say that there are some things about formula to consider as well. And that might make it a better choice for some moms. Formula feeding allows for the partner to be more involved with the feeding duties. We can achieve similar with pumping, but formula certainly has that convenience to it. There's a flexibility with formula where you don't necessarily need to, schedule around baby's feeding schedule or pumping schedule. We know formula-fed babies take larger feeds, and they might feed less frequently for that reason. That might allow for more flexibility as well. We also know women don't have to worry as much about what they put into their bodies and how that's going to affect the baby, if they're formula feeding.
That's interesting you say that because on our team, we have two brand new babies in my department, and I've learned so many things about babies in the past 6 months. And I recently found out that, it's not recommended that moms like take Dayquil or NyQuil when they're sick if they're breastfeeding, because obviously that transfers into like the breast milk. And that was just like mind blowing to me. I was like, I didn't even know that was something you need to look out for.
Exactly. Yeah.
Well, and I really appreciate the balance you presented, because I feel like I've heard from friends and even from my spouse when we were expecting that a lot of what is presented is sort of breastfeeding. And I appreciate you recognizing there's pros and cons on both sides in some cases. And you also started off by saying it's not possible for everybody. And so I'm wondering if we could talk a little bit about some of those common obstacles that parents face that maybe stop them either from breastfeeding at all or breastfeeding as long as they intend to.
Yeah. And I think, breastfeeding is a very natural thing, but it doesn't come naturally to everyone. There's certainly challenges even for women that are experiencing many challenges, just the time commitment, it really feels like a full-time job, when you're breastfeeding. So the CDC releases a breastfeeding report card every few years. And just from the numbers on that, you can see the challenges that exist. We know that about 83% of babies around 2019, 2020 started out breastfeeding. And by the time that they were 6 months old, there was only about maybe 50% that were continuing to have at least some breast milk. So the numbers kind of show that challenge. I would say that one of the biggest challenges I see is personal comfort for the mom. Breastfeeding can certainly cause pain, discomfort. Initially, it can be normal if it's mild to moderate in the first week or two, but if it's severe, if moms are dealing with infections, engorgement, mastitis, those things can definitely cause them to sometimes stop breastfeeding. We see that commonly there's struggles with supply and worries about if their baby is getting enough milk. And that's a huge one that I deal with on the pediatric side. There's also that timing and frequency of feeding. As I said, it's a full-time job, especially if moms are trying to, recover from labor and they're trying to get sleep and they're working and they're running errands and they just want some personal time. It's very, very difficult sometimes with that. I can also see that, we mentioned with the diet and what moms are eating, some babies, it's not common, but they might develop something like an allergy, milk protein allergy being the most common. And that forces the mom to really alter her diet. For some women, especially if they're vegetarian, for example, to tell them to cut out dairy is a huge thing to do. And that is a huge kind of added stress for them as well. And the last thing I would say is that the support at home and work is a huge factor with, continuing breastfeeding or not. If they don't have that support at home, if they don't have it at work, especially with that transition back to work, that could be a major reason for them to stop as well.
Yeah.
That makes a lot of sense. And, I think a lot of times, I've never breastfed. I don't have any children, but it's like you're sharing your body
Yeah,
with the child for, the 9 months that you have them in your belly, and then for however long you decide to breastfeed. And so that's a long time to go without feeling like you have control over your body, if that makes sense. And so
exactly.
I think it's incredible if anyone tries to breastfeed, and whether it works or it doesn't, like that's something that you're trying to do for your child, and I think that's incredible. We'll kind of jump to lactation consultants. I know most parents are introduced to them when after
Mhm.
giving birth, like they'll come in the hospital room and try to start latching and get breastfeeding started. But that's sometimes the only time they may interact with the lactation consultant. Without support from an LC, breastfeeding can seem intimidating. So do you have any tips or tricks you recommend for new parents attempting to breastfeed,
Yeah, and
or any best practices?
yeah, absolutely. And I think you kind of said it right there, meaning that they only interact with lactation consultants in the hospital. I would say the biggest thing I can say is to not let that be true, to reach out for help early and
Right.
frequently. We know that milk supply is really established in that first month or so after baby is born. And that is the most challenging time for breastfeeding because you're trying to figure it out, baby's trying to figure it out, you're sleep deprived, you're recovering from labor. The frequency of removing milk from the breast is what really ultimately determines that supply. So if you can reach out early for help, that is very much key. In terms of where to reach out, so you certainly see lactation in the hospital, but once you get out, we as pediatricians see you within a couple of days from discharge from the hospital. There are often lactation consultants at the pediatrician office. If not, they can often make a referral for an in-person lactation appointment for you. You can also access them often through your OB/GYN because breastfeeding is very much an intersection of mom and baby. I'd also mention that, Maven has lactation consultants virtually. We can also virtually refer you in person or give you an idea of where to go in person as well. So that's kind of the biggest thing is just getting that help, that support, and keep reaching out whenever challenges are coming up.
I want to ask a question, and it may seem kind of obvious, but I want to make sure that we're putting it out there for anybody who's trying to decide, who's maybe grappling with some of the challenges we talked about before, isn't sure about access to in-person lactation consultants and so forth. But is there for baby and for parent, are there differences between actually directly breastfeeding the newborn versus pumping and using bottle feeding? Are there any health differences in the two?
Yeah, that's interesting. So there's this theory of the feedback loop, meaning that if you directly breastfeed, there's some evidence that there may be feedback from the baby's mouth saliva to the mom's body and what she's producing in terms of antibodies. So it might be like what you can call as more personalized breast milk for the baby. That being said, there are huge benefits just to getting any kind of breast milk pumped or directly breastfeeding. And we also know that even small amounts of breast milk can have a good benefit for baby. There's one study showing even as little as maybe 2 ounces or 60 milliliters per day does have benefit for babies. So even the moms that are out there combo feeding, are definitely providing that benefit for their baby.
I appreciate that, because I know one of the biggest challenges, one of the biggest decisions when my wife was expecting our first kids, twins, was which breast pump to buy. And then that's also one of the biggest questions and that we get from expectant parents is sort of, what is your coverage for breast pumps? Do you cover the premium ones and so forth? So we've gone round and round with that for the year. So I appreciate that insight.
And, I know we touched a little bit on lactation consultants through Maven and, being able to refer some or refer a member to a lactation consultant in person. But, is there any more support from Maven Clinic, and what does that look like in helping parents meet their breastfeeding goals?
Yeah, so Maven provides a 24/7 on-demand lactation consultants, as we mentioned. We have a variety of other providers, as I mentioned, the pediatricians, OBGYNs, because again, breastfeeding, I often have members coming and saying, well, I didn't know if I should book with you or book with, somebody else, because it kind of involves everyone, at once. We also provide support to people in rural areas, more vulnerable populations. One of the most amazing things about being on this platform is just reaching people that I couldn't reach, in my day-to-day practice. We also have a lot of education on Maven. There are classes that we do. There's already existing library of articles that we can have members looking at to see best practices, tips that we would recommend. And then I think, as Mary was mentioning, we have a lot of return to work support, with helping to plan out what that looks like, how to make that transition, as well as advocating for yourself in terms of what you need, especially if you're going to be pumping or having that kind of schedule.
Excellent. And I know you've touched on various ways that Maven supports parents throughout the journey, but wonder if you've got any statistics to back up sort of what that looks like in reality for folks.
Yeah, so we know that 60% of maternity members actually report that they do breastfeed for longer because of the support that Maven is able to provide. And that includes, again, that 24/7 access to lactation consultants. We have that guided education, as I'd mentioned, Breastfeeding 101, and that workplace transition support. From my perspective as a pediatrician, I especially feel like I can serve as a role of a cheerleader for a lot of these parents, because I think I mentioned one of the biggest things I hear is that you're just so worried if your baby is getting enough milk or not, and you're struggling with supply. But as a parent, you're always thinking about your child first. And I can actually, spend time, going over, how do you know that your baby is getting enough milk? What does that look like? What do we measure, to kind of, judge that? When would you need a supplement? We can also kind of cover, how you can increase your supply, maintain your supply. So I kind of tell everyone, when I see them, that, keep reaching out to your pediatrician, keep doing those weight checks, keep getting that reassurance and guidance that things are going well, because mentally that's a huge weight off your shoulders in terms of the journey of breastfeeding.
Absolutely. And I think when I was asking my coworkers too, one of them was like, yeah, like, how do you even know if the baby's being fed enough? So, and I was like, very real, very real. I wouldn't know I wouldn't know.
Yeah, very, very common question.
So that's great to hear that, Maven provides support for questions like that. And, I will say I'm, a couple of years into the workforce, and I feel like since I've joined, especially when I came to AFSPA, I thought it was really impressive that we had, not to toot our own horn, but we had a lactation room for any mothers who, do breastfeed, and there's a refrigerator in there. You can store your milk, do whatever needed. And I remember calling my mom, and I was like, this place is so nice. And, talking to other friends, I know it's more common. So like, what would you say would be the best for how workplaces can best support parents who do breastfeed?
Yeah. So that lactation room is huge. Just having a place to go. We know that most moms are going to be pumping, when they are going to come back to work. So I would say that the privacy of the room is important, being able to lock the door, having the fridge, having the sink, to wash, a comfortable chair. We know that pumping is easier when you're comfortable in terms of the electrical outlet being right there. For example, looking at pictures of your baby while you're pumping is actually known to increase milk supply. So those things are important. I'd also say just having a protected and dedicated, time to pump, where it's not treated as a break. Even in my own field, we have colleagues who are pumping, and sometimes, there's a little bit of resentment or there's a feeling like they're getting extra breaks, but treating it more of like this is just part of their normal schedule, as a breastfeeding mother. And in light of that, I would say communicating with other managers, staff about policies on breastfeeding so that they can also be supportive of employees that are breastfeeding.
And yep, this is a very timely discussion. I mentioned before we actually started recording the interview portion here that we do have three colleagues who are currently expecting, and there's actually a baby shower going on right now for them. So good feedback for me. I will share that with others on the management team. So, but before we wrap up, is there anything else that you'd like to add for our members when they're thinking about breastfeeding or anything in sort of that early newborn stage?
Yeah, I think again, as I was saying, just reaching out for support. And so if Maven can be that support for them, that 24/7 lactation advice, sometimes at, 3 a.m, you're just not sure what to do. It's amazing to be able to kind of have somebody to talk to until you can kind of see your own pediatrician or somebody in person. So I would just kind of, put in that plug of just making sure that you have your village and your support network built around you with both, in person and virtual.
Perfect. And Mary, I'll throw it back to you. How can FSBP members access Maven?
Yes, well, thanks so much for such a great conversation. So FSBP members and their partners, again, have free 24/7 support to Maven Clinic. You can sign up using the Maven Clinic app in the App Store or Google Play, or I'm sure Maddie and Kyle will circulate, but we have a website, mavenclinic.com/join/FSBP. So you can sign up today. Don't hesitate to reach out with any questions. And again, want to reiterate that no matter where you are in the world, you're getting that same 24/7 support.
Excellent. All right. Well, Mary, Dr. Radia, thank you all both so much for joining us today to talk about this important topic during this Awareness Month. And we look forward to connecting with Maven again soon.
Thank you.
Thanks again to Dr. Viraj Radia and to Mary Rood Cunningham for joining us for today's episode of AFSPA Live. As noted, FSBP members have access to all of the programs offered through Maven Clinic. Most programs are offered at no charge to FSBP members worldwide. Please note that while FSBP members do have access to the Maven Milk program, which offers shipping services for express breast milk, those services through Maven Milk are not covered by your FSBP benefits and do require members to pay directly. For more details about all of Maven Clinic's programs and how they work with your FSBP benefits, please visit mavenclinic.com/join/FSBP or click the link in the show notes. You can also find more information about other coverage for maternity and lactation consultants and all of our benefits and programs offered under the Foreign Service Benefit Plan at afspa.org/FSBP. This has been AFSPA Talks, a production of the American Foreign Service Protective Association. All information offered in this podcast is meant to be educational. The views expressed by the hosts and guests are their own and do not necessarily represent AFSPA. Should there be any discrepancy between information offered in the podcast and official plan documents for the Foreign Service Benefit Plan or other products offered by AFSPA, the policy provisions will prevail. Thanks for listening, and be sure to subscribe and follow AFSPA Talks to catch our next episode. Rate and review us on your favorite podcast app and share feedback with us on Facebook, Instagram, or LinkedIn. Search for AFSPA Cares. We'll talk again soon.
Thanks for listening to this episode of AFSPA Talks. Be sure to subscribe to our channel so you'll never miss an episode. If you have any follow-up questions about the topics in this episode, join our AFSPA Live Q&A session on the last Thursday of every month. We will be streaming live at 11 a.m. Eastern Time on our YouTube channel at youtube.com/AFSPA Cares. Thanks for listening.